what is one thing or a couple things that, like living with VEDS, that you would want medical professionals to know?
Remember VEDS basically, like I said before, just the traits. Like I'll tell doctors, if you see a child dislocating his knee a lot and more often than anyone else, and that's before getting into depth on more serious situations like I had, the cardiac dissection, look into it more to see why this child's dislocating his joints. I'll tell anyone that to get it at an early age till when to something serious, because they say, I've read up on vascular illness, most of the serious case happens when they're in the late 20s or the early 30s. My serious case happened when I was 32.
So, and then if you had known, you probably would have taken that headache more seriously when you lifted
Yeah,
the chairs.
exactly. If I would have knew, like, okay, I have a headache, I had chairs on my head, and I went to the doctors. The doctor would have did an MRI or MRA of my brain and my neck and would have saw the tearing of the carotid artery in my neck. They would have saw or try to repair it or put me on some type of thinner at the time and keep the blood flowing to my brain.
Yeah.
And when I want to have so much paralysis till the 13. I still have paralysis. My leg, my arm is still, I can't open my hands too well from the incident. It's been 13 years. Doctors say a lot of it's not gonna come back.
Someone who specializes in the really rare cases, who sees a lot of them, who has the time to read the literature that is out, it's important. I can't expect my cardiologist here, because he's got one VEDS patient, to read every journal article that comes out about VEDS. Like, that's my job, that's my wife's job. We're here to tell him, you know. But I also know that when I go in, if I have an emergency, they know I have VEDS. They know they're going to be really careful. They're going to move slow. They're going to take the necessary precautions that you have to do with a person with VEDS. A vascular surgeon, cardiac surgeon in Tampa, who saved my life, you know, told my wife that it was the most difficult surgery with the best possible outcome that day. But he knew there was something greater that he couldn't fix. There's something else going on that he couldn't fix. The next day, he did 4 heart transplants, but I was his difficult case that week. you know. So that tells you that these surgeons know what they're doing, but I think it's really good when they talk to each other. So I probably the answer is no. I don't have advice for medical professionals, but I hope that they know how important they are to our psyche. Maybe that's the thing.
Yeah, I love that. Like just having that knowledgeable person on your team or one who's willing to consult with someone who is.
Yeah,
Like that puts me at ease, you know?
absolutely,
Yeah.
absolutely.
Some of the things I would like for medical professionals to know and think about is that although they could never truly understand what it's like to have VEDS and lose someone they love from it, that although they couldn't, it's like if they're willing to try, all we need is someone who is understanding of us and our pain as we search for a cure and to live our lives with this condition every day. And when I say someone who's understanding of us, I just mean someone who will listen to us, listen to what we have to say as we know our bodies best. And if they don't know something, do what it takes to step outside of their comfort zone and learn it. Or, asking us or those who have studied us is really the golden ticket to really understanding how to best care for us. I ask to please set aside what you think you might understand and know, and open up your heart and mind to the rare possibilities and challenges that VEDS brings to the table. And please know that you're working with a community of beautiful humans who are constantly having to say goodbye to loved ones and fight for our health, and without answers or closure of why. But you know, together we still manage to fight for victory and stick together with love and everything we've got, and never give up hope that there is something more for us. I asked them to not only hear us, but fight alongside us and join our community. I ask that if, you know, if you're at all stubborn and not willing to be brave and vulnerable in your practice alongside us, then please, please send us to someone who will and who has the time, because we really don't. And lastly, I do really want to thank every medical professional who has dedicated their lives to finding a cure and giving us hope, and treating us like their own family.
You know, what I feel like medical professionals need to know is that sometimes we come in with life-threatening situations that are not outwardly obvious. It could be we are young and look healthy and are not taken as seriously, or don't, or aren't bleeding, or some, like, you know, physical thing. Like, even in my case, it was so serious, but like I said before, it wasn't even the worst pain I had. But knowing I had VEDS, and knowing it's a struggle, right? Because my wife and I know it's always going to be a kind of a, for lack of a better word, a fight, kind of getting through the emergency room. So I think that's the one thing medical professionals just need to know about and learn, is that is to be taken seriously, so that you can get your scans right away and they can confirm or not whether there's something serious going on. You know, the other thing with medical professionals that I'd personally love for them to know about, and I've alluded to it earlier on in the conversation, you get your diagnosis, and some geneticists and things are pretty good about this, but it's certainly not across the board, is that, you know, again, it becomes about learning about the physical component of this condition, but I feel like the whole mental aspect of where you go from there and how you deal with that, I don't feel like those are openly encouraged or readily available for people who really need that, especially in the weeks or months leading after a diagnosis. So the patient themselves are not really being cared for from a mental perspective, and how to deal with a rare condition that, especially this, where things can happen out of nowhere, and you need to be ready for it. So those are some things that come to mind when I would like medical professionals to know about.
Just for the medical professionals here in Norway to acquire more knowledge about the disease. So we don't have all the things that you have, like medical bracelets and stuff, but we have something on the internet, like your medical journal on the internet. So in case of emergencies, the medical professions can look it up.
Yeah.
So in Kana, she says that she has VEDS, but I don't think anyone knows what VEDS is.
Yeah. So just more general knowledge.
Yeah.
Yeah.
I'm not a doctor, but they go through a lot of schooling. They learn a lot of stuff. They have to know a lot about the entire human body. And it takes someone like Dr. Shalou with years of research to even know as much as she knows about it. And I just wish those doctors would admit that they don't know it, and either say, all right, I'm going to take this on and learn this, or I will work with your specialist, because I don't know, and I know I don't know. But unfortunately, a lot of them just don't know and don't care to know even anymore.
You know, I wear a bracelet. I keep with me in my purse all the time, the vascular card and, the information with what the syndrome is, and, have everything tied to my cell phone. I have, if I have to go to the hospital, hopefully that's not the case, then I have it laminated, telling the doctors what's going on in the event that, maybe, I couldn't speak for myself for whatever reason.